Hello nurses, hope you're all doing well. This is Manjot from Pro RN Coaching Classes. Together we can conquer this. We are back with another topic, and before we start with our topic, if you're watching this video, do not forget to subscribe our channel and comment if you would like us to share any other topic with you. So the topic we're going to talk about is transfusion reaction. Let's start with this. First, we'll talk about the definition. What is a transfusion reaction? So, it is the adverse reaction which happens as a result of blood transfusion. So, transfusion reaction क्या होता है कि कोई भी adverse reaction जो कि जब client को blood transfuse किया जाता है during that time period जब उनको signs and symptoms adverse reaction के दिखाई देते हैं, that's called transfusion reaction. So now when we talk about different types of transfusion reactions, there are main three types of transfusion reactions which may occur in the clients receiving blood. Let's talk about all these three types, including their signs and symptoms. Now we are going to talk about different kind of adverse reactions in the clients who are receiving blood. So जब हम different kind of reactions की बात करते हैं, सबसे पहले we'll talk about febrile reaction. Febrile reaction में जब client blood receive कर रहे हैं and we notice one of the symptoms which we are going to talk about now, that may be a warning sign for febrile reaction. So इसमें क्या होगा? The first one is chills, fever. Client may complain of headache, flushing, and then tachycardia, which is increased heart rate and increased anxiety in the patients. So second type is allergic reaction. This allergic reaction may be caused by the blood product in the client. So the signs for this reaction may be hives. Hives is the itchy spots on the body. Then we have pruritus, which is itchiness of the skin, facial flushing, shortness of breath, bronchospasm. We have to make sure that we check the lungs of the clients to make sure there is no abnormal sounds like wheezing, crackles, and then anxiety, as we have already talked about it. The third type is hemolytic transfusion reaction. So what is hemolysis? Hemolysis is a breakdown of RBCs. So in this kind of transfusion reaction, there may be abnormal breakdown of RBCs in the body, which may lead to one of these symptoms or more than one. So it could be if the client is complaining of lower back pain. Hypotension is the decrease in the blood pressure. That's why it is very important to take the baseline vitals for the patient before starting a blood transfusion. Tachycardia, increased heart rate, fever and chills, then chest pain, increased respiratory rate, which is also called tachypnea, and there may be hemoglobinuria, which is the presence of hemoglobin in the urine. Now we get to the most important part of this topic. What is your responsibility as a nurse if a client is receiving the blood transfusion? So the first things we are going to talk about is key points, or the things which we have to keep in mind when we are going to start the blood. So that's before starting the blood. The first thing is we will have to verify client's ID. We have to check for the consent. So if a patient is receiving blood, after you check the primary healthcare prescriber's orders for blood transfusion, you have to make sure that there is an informed consent in the chart, or patient has been consented for blood product. And then we have to make sure the patient did not have any history or does not have any history of previous blood transfusion reactions. Then we have to double check the order from primary healthcare prescriber, check the blood levels when you get the blood from the blood bank. Then check baseline vitals. So we have to know what are the baseline vitals for the patient. The reason we need to know is because we have to make sure while we are assessing our patient during the transfusion, So we will know if there is any change in the vital signs. Then we should have the IV line. It should be either 18 gauge or 20 gauge. Normal saline solution, we have to make sure that we have a bag of normal saline with the IV line ready in case the patient has any transfusion reaction. Then blood transfusion always requires double check from the nurse. So it has to be 2 nurses. I'm saying that again. It has to be 2 nurses to double check the order before the transfusion could be started. So when we are checking the order and when we are checking the client information, what are the things which we need to make sure that are okay? So the first thing is we have to check the blood group of the patient. Then we have to make sure the RH type is same. We have to check client's name. We have to do this check on the bedside. Ask client their name, their date of birth, check their ID band, and then you have to check the expiry date of the blood product and check the orders for the rate and time for the over the time period which the blood has to go. Then we have to give the blood product. Do not give it not more than 4 hours. So the maximum time you can give a blood product is over 4 hours. Do not exceed it more than 4 hours, and it also depends on the orders from PHCP. It could be somewhere between 2 to 4 hours. Now you have done all your checks, started the blood, and the next thing is, what if the client reacts to that blood product? So अगर आपका client who is receiving the blood product, and if you notice any of the symptoms which we have already talked about in your client, then what is the responsibility as a nurse? First thing is stop the transfusion. So before doing anything else, you have to stop the transfusion. Then keep the IV line open with normal saline. As we have already talked about, a normal saline with the IV line beside the bed of the patient or with the patient who is receiving the blood transfusion. So we have to keep the IV open with normal saline. Notify the registered nurse, primary healthcare prescriber, and blood bank. Then stay with the client. Do not leave the client alone who is having a transfusion reaction, because it could be very dangerous and fatal. Stay with the client, monitor vital signs, and check the client for any worsening of signs and symptoms. In case the breathing is getting worse or the tachycardia is getting worse, so you have to monitor the client for any worsening signs and symptoms. Assist to administer emergency meds if there are any orders, PRN orders, for in case the client has the transfusion reaction, because you usually, when in the hospitals you give the client's blood, you get standing orders for the clients for the transfusion reaction. So be prepared, stay ready for infusion of those medications. Then return the blood back. This is very important. You have to return the blood bag, tubing, labels, and transfusion record to the blood bank. Then we have to document the occurrence, actions taken, and client's response to whole situation. Do not forget, if you have not documented, you have not done it. It is very important to document the occurrence, what you have done, and how the client has responded to the treatment. If you're still watching this video, do not forget to subscribe our channel so you could stay updated with our latest videos. And if you need any help with your nursing exam, you can always contact on the details given below in the link. Stay tuned. See you again.